Hi, everyone. My name is Nellie. I'm a lactation consultant here at Long Beach Memorial Miller Children's and Women's Hospital, and I am going to be teaching the prenatal breastfeeding class to you today. I'm super excited that you are here, that you found this video. I have a ton of information to share, and I'm very, very passionate about breastfeeding. So let's jump right in. My name is Nellie, like I said. I've been a nurse for about 15 years. I did general pediatrics prior to doing lactation. I have two small kiddos. They're now 6.5 and 4.5, and I tell you, time goes by so quickly. But my struggles with breastfeeding brought me to what I'm doing today. Both of my kiddos had issues with breastfeeding, and I was the patient. And I saw I felt very, very supported by the women that I worked with, my lactation consultants, and it inspired me to also become a lactation consultant. And I could not be happier. And like I said, I'm very, very excited that you're here today. Okay, so you're here, you want to breastfeed, but let's talk a little bit about the benefits of breastfeeding and see, first of all, what do the experts say? So the World Health Organization, they say that breastfeeding is an unequaled way of providing ideal food for the healthy growth and development of infants. It's also an integral part of the reproductive process with important implications for the health of mothers. Review of evidence has shown that on a population basis, exclusive breastfeeding for 6 months is the optimal way of feeding infants. Therefore, infants should receive complementary foods with continued breastfeeding up to 2 years of age or beyond. So the World Health Organization is recommending at least 2 years of breastfeeding. With the first 6 months, no other food or water. Your baby doesn't need anything else, only breast milk. Your body will provide everything that your baby needs, even water. So WHO and UNICEF recommend initiation of breastfeeding within the first hour of life. Exclusive breastfeeding, like I said, nothing else, no food, drink, water, tea, rice, cereal, anything. Breastfeeding on demand, that's as often as the baby wants, day and night, and no use of bottles, teats, or pacifiers. The American Academy of Pediatrics here in the United States recommend exclusive breastfeeding for the first 6 months of life. Again, they've aligned with the WHO, which is the World Health Organization. And they've changed. They used to say that breastfeeding for 1 year was the goal. They've actually changed their recommendations to align with the World Health Organization and have recommended 2 years. At 6 months, you can continue to breastfeed while introducing solid foods as complementary foods. Some pediatricians are still recommending starting rice cereals and things like that around 4 months of age, but really we want to wait until the baby's gut is ready and developed, which is closer to 6 months old. Continue breastfeeding until 2 years of life, or as long as the mother and the child mutually agree. This has to be a decision that both of you are comfortable with. So if it's not working for one party, then that's when breastfeeding stops. For the Centers for Disease Control, the CDC, their statement here is that it is one of the most highly effective preventative measures a mother can take to protect the health of her infant is to breastfeed. I think that's a really, really powerful statement. And I think if there was a medication that did everything for a baby's immune system and neurological development that breast milk can do, every baby would be on it. And we have it here. It's available. In that second year, so I know we talked about, we want to be breastfeeding for 6 months up to a year. And then in that second year, it changes, right? Breast milk is the primary food source in the first 6 months. It's still the primary food source for that second 6 months. So the whole first year, milk is the primary food source for babies, with complementary foods, which are foods that at that point now breast milk is not covering all your baby's bases. So you want to be adding in those complementary foods. After that first year, it kind of switches. The breast milk helps to build the baby's immune system. So it acts as kind of a continued immune support throughout that second year. So it has to be a personal decision between mom and baby of how long breastfeeding takes place, but the normal human age for weaning. So around the world, how long do people usually breastfeed for? Here in the United States, we all think 6 months. Now we say a year. Now we're saying 2 years. But around the world, it can actually be between ages 5 and 7. Take that in for a moment. We have this immune support that we can continue to use. And in our developed country, we have access to clean water and clean food. And so we're going to be not needing as much of that and medicine. So we're not going to be needing that immune support the same way that we might need if we were in an underdeveloped country where we don't have access to clean water, we don't have access to medications. So that continued support from the breast milk is really, really helpful. So it might seem odd, it might seem weird to us to be breastfeeding for that long, but just know that extended breastfeeding is actually really quite normal. Okay, so what is exclusive breastfeeding? Only breast milk, no extra food, no extra drink, not even water. It's all the baby needs for the first 6 months. So really, your goal should be to try to exclusively breastfeeding. Introduction of formula early on can lead to a lower milk supply. You may not reach your breastfeeding goals, and it can cause engorgement if we're not removing that milk from the breast. So make breastfeeding your goal. And if you need to or want to introduce formula in the future, that's something we can work with you on. But we don't want to introduce that too early because it just disrupts that normal process of breast milk and lactation. And we want to make sure that that process can happen as it should. So we'll talk more about how the milk making process, but the making breastfeeding your goals and tips to help. So rooming in at the hospital and at home, keep the baby skin to skin as much as possible, respond to early feeding cues, breastfeed at night when those milk making hormones are high, avoid formula unless medically indicated, avoid pacifiers and nipples until breastfeeding is established. That's going to look like about 3-4 weeks. We don't want to use any pacifiers or any bottles. We'll talk a little bit more about that a little bit later. Find support groups for breastfeeding parents and contact a lactation consultant if you need help. You don't have to go it alone. So breastfeeding benefits. Breastfeeding is good for you and your baby. Human milk for human babies. It is free and always available. It provides the best nutrition for the new baby, improving the baby's overall health and well-being in the present and the future. It promotes bonding between you and your baby. It contributes to the baby's emotional development. It's free, environmentally friendly. There's no waste. And the approximate cost for a year to formula feed can be over $3,000. So it's more cost effective to breastfeed, and it actually reduces the medical bills because it is the healthiest food that you can give to your baby. It does prevent illness. So how does it benefit our babies? It provides nourishment for your baby's growth and development, lowers the risk of sudden infant death syndrome, protects against respiratory and diarrheal illnesses. It's super easily digested, reduces ear infections, decreases obesity later in childhood, decreases the risk of childhood cancers, lessens the likelihood of type 1 diabetes, and protects against allergies. So like I said, if there was a medication that did all of this for our babies, we would be signing us up. It has all of the nutrients that your baby needs. It has antibodies that fight off viruses and bacteria. It helps protect your baby's gut from germs and diseases, and it helps them grow really fast. So babies in the first 4 months or so, they gain about 1/2 ounce to 1 ounce a day after the first 5 days. Typically, babies will lose weight in the beginning, and then they are back to birth weight by 2 weeks, and then they start to pack it on 1/2 ounce to 1 ounce a day. They double their birth weight by 4 to 6 months and triple it by a year. So they grow really, really quickly. I think this picture really speaks for itself when we're looking at the difference between formula and breast milk. Breast milk provides all the nutrients your baby needs. Full-term healthy babies don't need supplementation unless for a medical treatment or if breast milk is just not available. Supplementing with formula for non-medical reasons comes with risks. Formula can decrease the healthy bacteria in your baby's gut that protects against infection. Formula is harder to digest, causing less time at the breast. So baby's too full, they don't want to wake up to feed because they're still digesting, which can lead to engorgement because your breasts want to be frequently emptied and impact your milk supply. So it might not help you reach your goals. Okay, so benefits for you. Lowers the risk of osteoporosis later in life, reduces the risk of maternal cancers, so breast, uterine, endometrial, and ovarian cancers, decreases insulin use for a breastfeeding parent that has diabetes, releases a hormone that helps your uterus to shrink, helps to prevent excessive bleeding, decreases the risk of anemia infection, and actually aids in weight loss. You can burn more calories breastfeeding than you did when you were pregnant. If you have diabetes that uses insulin, you're going to decrease your risk for use of insulin. If you have gestational diabetes and you're able to breastfeed for more than 3 months, it's going to reduce your chance of actually developing diabetes later in life by about 60%. So if you have gestational diabetes and you're able to breastfeed, try to breastfeed for at least 3 months, and that reduces your risk of developing diabetes later in life. So breastfeeding is really, really beneficial. Okay. So we're going to move on to skin contact. There's huge benefits to just holding your baby on your chest. It's recommended by the CDC and the American Academy of Pediatrics. Skin care is the practice of placing the infant directly on the parent or other caregiver. Skin care is encouraged immediately after birth and until the first feeding has finished or as long as the parent wishes. So when the baby is born, that's the natural position to put your baby is right on your chest. Usually babies will be very alert at this time. Skin helps stimulate those reflexes for breastfeeding. Some babies are going to latch right away after delivery and other babies are not. So if your baby doesn't latch, that is okay. Skin is still super beneficial and your baby has time to learn how to breastfeed. We can use our hands to remove drops of milk from the breast. We call it hand expression. And we can give your baby small drops of colostrum to help them through until they're ready to actually latch. And we'll talk more about that shortly. More benefits of skin to skin. So it soothes and calms your baby, so your baby will cry less. It helps your baby regulate their temperature, their heart rate, their breathing, their blood sugar. It enhances bonding and helps your uterus shrink back down to regular size. Because your body is releasing that loving hormone, that bonding hormone, that's also your milk-making hormone, and it will contract your uterus as well. So just holding your baby on your chest is going to help to heal your body. All the procedures and all the assessments the goal is to have all of that happen skin to skin on the parent's chest, and the goal is to have no separation. They did a study in Australia that showed that babies that were held more skin to skin actually had higher IQs and were closer to the parents. It just wires the parent's brain to answer to their babies and helps babies feel very comforted and close. We are mammals. Our body heats up to keep the baby warm. So the birthing parent, the body will increase temperature to keep baby warm if they are cold, and it will decrease in temperature to help the baby cool down if the baby is too hot. So we don't need to bundle babies in blankets to keep them warm. We are mammals. When put close skin on skin, that's the warmest your baby's going to be. You can always put a blanket over the back of baby just to prevent any drafts or airflow from getting baby cold on the outside. But skin to skin is the best thing you can do for your baby. So what does that look like? So safe positioning for skin to skin. So remember, babies should always maintain good skin color. They should respond to stimulation. So we want to make sure that we have baby in a safe space on your chest so that babies can breathe well and have good circulation. So that's going to be in a semi-upright reclined position, and alert. If you're sleepy, it is not safe. We want to make sure that babies sleep in a separate sleep space. So if you're sleepy, it's best to have an alert adult there at the bedside to help out, or have that alert adult do the skin to skin. The infant should be in the middle of your chest, the middle and high up on your chest. I know it's kind of hard to see the slides and see me. I think I'm a tiny box in the corner over there, but we want to have baby high up on our chest, just kissable. So baby's nice and high up. The infant's shoulders and chest are facing you. The infant's head is turned to one side with the nose and mouth visible, and the neck is neutral. So we don't want to have their neck flexed all the way this way or all the way tucked down. We want to make sure that their neck is neutral and that their nose is pointing up and away so that we know that they can breathe well. So neck is straight, the arms are in nice and tight, flexed like they were while they were inside. It's okay to have them with their arms and legs tucked close in a little, like in a little ball. The infant's back covered with a blanket again, so that they don't lose heat from the outside. Your partner may want to consider bringing a zip up hoodie so that they can put baby down on their chest and zip up the hoodie sweater so that they can feel covered and snuggly and warm with baby there. So a zip up hoodie is a nice thing for a partner to bring. Okay, so after baby is born, what happens if your baby doesn't want to latch? And I told you we could get drops out by hand, right? So you're going to ask your nurses and your lactation consultants to show you hand expression, review hand expression with you, and practice. So it's a good skill. You want to learn how to do it. It might feel a little bit awkward at first, but it's very important. Be patient, ask for help. Don't get discouraged if you don't see very much colostrum, which is your first milk. The baby gets way more than we can see. So if we are just squeezing, we're not going to get out as much as a baby that's doing that squeezing and sucking at the same time. So the suction and compression that a baby does, they are going to get more milk out than we can see by hand. Just squeezing the breast, sometimes we get discouraged if we don't see any milk or we don't see a lot of milk. So don't be discouraged. It's expected to only see tiny little beads, little drops of colostrum, if anything at all. Okay. And every breast is very different. So one technique might work for your breast and it may not work for somebody else's breast. So finding that spot where you're able to squeeze your milk out by hand is going to be really, really helpful. If your baby's not ready for latching, if your baby comes out and your baby's just not really in, organized or not ready to latch to the breast, it is okay. We can give drops of milk, and that actually counts as a feeding in the first 24 hours if your baby's not ready to latch. We'll talk more about baby's behavior, but hand expression is going to be really, really important to make sure that baby can get drops of milk until they're ready to do their job. Okay, so if you get separated from your baby, if baby has to go to the NICU, or if you have to go for a procedure, it's important to know how to hand express milk because a pump will not get milk out of your body in the first few days. The first milk that you're making is very thick and sticky. A pump only does suction, which is half of the baby's job, and it's not good at getting colostrum out. We might use a pump in the beginning if we need to stimulate your body, but a pump is not going to remove milk the same way that your hands will, okay? And drops is all you need in the first 24 hours. So knowing how to hand express and practicing after your baby is here is gonna help get those drops for your baby. Now, if you're watching this, hopefully you are still pregnant. We haven't had the baby yet. I don't want you to work on hand expression unless you have permission from your OB, okay? Because that nipple stimulation can stimulate labor. They do use nipple stimulation to stimulate that. So I don't want you to practice this until your baby comes unless your OB has given their blessing, okay? Okay, so I know this tiny little picture here. First step is we're gonna wash our hands. Then we're gonna massage all the way around like you're doing a breast exam. You can't really do it wrong. We're just trying to massage and move that thick, sticky milk in the breast. Next, you're going to place your hand in kind of a C shape around the breast. Keeping your fingers wide, you're going to press back. See if you can see my breast model over here. So a C shape, fingers on either side of the areola. We're not squeezing the nipple, we're squeezing the breast. Okay, so using your areola as a guide can be helpful. Keeping your fingers wide, we're going to press into the breast towards the chest wall. And then we're going to squeeze fingers together when we're a little further back behind where those milk ducts are. Okay, so you can have your hand in whichever position around the breast is comfortable. It doesn't have to be 9 and 3, 12 and 6. It's however, there's ducts all the way around. So whatever is most comfortable for you, best to just keep your fingers in a straight line across. Sometimes I'll have parents that come in and they want to use 2 hands, but what ends up happening is they're compressing on either side of the nipple instead of being in that straight line across. So we want to make sure that when we're compressing, that we're really getting right straight back behind the nipple, not squeezing the nipple itself. I'm going to stop sharing my screen for a moment so that we can, so that I can make sure that you can see how I am doing that with the model. Okay, so we have our breast here, C-shaped hand around the areola. Now every breast is different. You may be closer, you may be further apart, but the basic general starting position is going to be at the border of the areola. So the dark part here, fingers in line across the nipple, a press in towards the chest, and then compressing fingers together. It can take 3 to 5 minutes of massage and expression to even get that first drop to come forward. So we don't squeeze harder trying to get more milk to come out, because that just makes everything feel ouchy. It gets it inflamed in there. And if it's swollen, it's going to just be painful and more difficult for the milk to come out. So we want to always be gentle with the breast, and that milking, right? We're expressing by hand. So just that motion is going to push drops forward, and then you'll start to be able to collect those drops rather than squeezing harder. Okay. All right. So I'm going to come back and share my screen with you again. Give me just a moment. Okay. So hopefully we are back in our okay, perfect. Okay, so now let's talk about making milk. This is one of the big questions. How do we make enough milk for our babies? So you want to start the process off by breastfeeding your baby as soon as possible after delivery. And again, if your baby's not ready to latch, it's okay. Hand expression is where you're going to get those drops for your baby. That's going to give your body the stimulation. It's going to help remove those drops of milk so that your body knows it's time to get started. Colostrum, that liquid gold, is the first milk that your body is going to make, and it starts being made somewhere around 16 weeks of pregnancy. So if you are pregnant and you are past 16 weeks right now, your body is already producing and storing colostrum for your baby. You're going to have the right amount of milk for your baby's small, tiny tummy. It's all that your baby needs for the first few days. And your breast will not feel any different at this stage. So it's the birth of the placenta that triggers this huge change in hormones. So while the placenta is still in house, it says not yet to the lactation hormones because it's not their turn yet. We're still making the baby. It's still cooking. It's the lactation hormones need to take a back seat. So once that placenta leaves the body, there's a huge shift in hormones. The lactation hormones have a party, and then that milk is much more easily expressed. So if you get your blessing from your OB to go ahead and start practicing hand expression and maybe even collecting some drops of colostrum, freezing, labeling with the date and the time, keeping it in the freezer if you would like to store some. It is not expected that you have to do that, but it's something that some women will do. Expressing beforehand with the blessing of the OB, you can store some of that milk for when your baby is here. That being said, don't bring in your milk with you to the hospital. That's something that you will bring in if it is needed, okay? We want to make sure that gets stored at home. So after your baby is delivered, you're going to be like, I don't know, this doesn't feel like there's anything in here. My breasts don't feel any different. That is normal to feel that way. Like I said, your body's been making this milk since 16 weeks pregnant, so your breasts are not going to feel any different. But your tiny beads and drops of that milk, it actually has a laxative effect and helps push that poop out of the baby's body. So it starts to clean out their bowels, helps them get ready for feeding. It coats their stomach and coats their intestines, helps setting up their immune system, and it helps them get ready for feeding. So once that poop starts coming out, the drive to want to eat is going to go up. Breast milk is super easily digestible. And it's available right after delivery. Now, if your baby is delivered early, just know that your body knows this. There's a conversation between the breast and the placenta on what kind of milk to make for your baby. So if your baby is born early, your body will make preterm milk, which has more protein and more antioxidants in it. So it's going to just make a perfect food for the age of your baby. Your breasts are not going to feel any different until between days 3 and 5, when our milk starts to transition. So between 2 to 5 days after delivery, with all of your baby's stimulation, right? The first day, they don't want to do a whole lot. Then after all the stimulation that they eventually start doing, usually after the first 24 hours, that milk volume will start to increase. So we'll have a bigger volume. Your breasts are going to feel heavier. They might feel warm. They might feel full. They might start leaking. You can use breast pads inside your bra to absorb the milk, or milk collection devices. There's different things on the market that you can put down into your bra. Looks like a little cup. There's different brands. Haka is one that most people are familiar with when they start it's like a big brand out there when you start looking into these milk collection devices. Just being very cautious that if you are going to give that milk to your baby that has leaked out, that you are storing it within an appropriate time frame. You are washing the milk collection devices like you would any other feeding device, right? We want to be just safe with our baby's food. So we want to collect it frequently, store it frequently, and wash frequently. Okay. So, but it's nice to have something that's going to collect and store the milk that otherwise would have been just lost to a breast pad. So you may feel tired and overwhelmed in the beginning. Just remember to rest when your baby is sleeping. So that first day, your baby is going to be sleepy. And I know it's hard for you to rest when you're so excited after first, having your baby. You want to share pictures, you want to tell your story, but that's when your baby is resting. And that's when you want to take advantage of taking some rest too. So during those 2 to 5 days, the milk volume is going to increase. We're going to be on our way to mature milk. So the colostrum and the mature milk are kind of mixing together. We call it transitional milk. And we'll have mature milk usually around somewhere between 10 and 14 days. So frequent feedings is going to help the milk increase in volume. The more your baby demands, the more milk the breast will supply. So we want to make sure that we let baby do their job. So here is the stomach capacity of a newborn. Like I said, drops are all your baby needs in the first 24 hours. Their tummy is the size of a cherry or a grape. It's super, super tiny, and it's not very stretchy in the first 24 hours. It does stretch and grow, and by day 3, it's the size of a walnut. By the end of the first week, it's the size of an apricot. And by the end of the first month, it's the size of a large egg. So the tummy gets pretty big pretty fast. And we expect that your breast will produce milk according to your infant's stomach size. Your body is very smart. It's not going to produce large volumes until your baby has the space for it. And it knows when that time comes by all of your baby's stimulation at the breast. All of their demand is going to tell your body how much milk to make. So baby suckling sends a signal to your brain to release the hormone to make milk. So we've got the baby sucking, your body feels it, your brain registers it. These hormones tell your body to release the milk. So the brain sends the hormones back to the breast, and then the breast releases the milk. So we need baby to be at the breast demanding the supply so that we'll have a big supply when we're ready for it. So we're going to breastfeed as soon as possible after delivery and then on demand. So if your baby's not demanding it in the first 24 hours, it's okay. That's where we're going to keep offering. And if baby's not interested, super sleepy, they're recovering from birth too, that's when we're going to give those drops of the milk. Okay. So between days 5 and 14, that's when we're going to have that noticeably higher volume. Your breast may become uncomfortably full. So there's a process called, if you've heard of engorgement before, there's a normal engorgement where the breasts are starting to increase how much milk they make. And your body is also adjusting to becoming one human again. You're two people for an extended period of time, almost 10 months. So your body has too much blood volume, too much fluid. You get fluid during delivery through the IV. And so there's a lot of extra fluid in your body. And as that fluid tries to get out, your body's trying to process all this extra fluid. It's going to go to places in your body that hang. And the breasts hang all of the time. Okay. Think of a swollen ankle. If your ankle is swollen, it's sore, and it's hanging all the time, you're walking around, you're sitting, you're not elevating it, that pressure in there is not going to get much better, right? So as you walk around and elevate your leg, the muscles help move the fluid, and then just elevating it just naturally is going to help that fluid come down. So there are some exercises you can do with your breast. It's very, very simple. To elevate a breast, you have to lay down, bringing your breast up higher than your heart, and allowing the breast to drain into the armpit where the lymph nodes are for the breast. So laying down and then moving your breast in big circles on your chest wall, helping to move that fluid around because there's no muscles in your breast, right? So we're going to lay down, move them around. It's going to help you get through that normal engorgement because we have this full breast. And a lot of us think, oh my gosh, I have so much milk now, I'm going to go pump it out. And then you try to pump and we don't get a lot out with the pump because we have this traffic jam in the breast of fluid and increasing milk volume coming together. So if we can kind of reduce that fluid that's accumulating there, lay down, take the pressure off, it helps the milk to flow easier, it helps to make you more comfortable, and it helps to get your baby latched on to a softer breast. Okay, so just remember, as that milk volume is coming up, we're going to have some uncomfortable fullness that we can make better by just laying down and moving your breasts in circles. Okay, that's going to be a very simple way. We used to use heat on our breasts. We are going to use ice. We don't use heat anymore. Think of that swollen ankle. We're not going to put heat on it and hope that the swelling goes down. We're going to use ice as needed. But I think you'll see a really big difference if you can just lay down and elevate your breast. You're going to feel like you probably don't even need ice. Okay. All right. So usually you'll check in with your pediatrician about 2 to 3 days after discharge. And then again at 2 weeks, we expect that your baby is going to lose some weight initially. And then by that 2-week visit, we expect them to be back to their birth weight. So during that time, that 2-3 day visit and then the 2-week visit, we're going to make sure we're counting the diaper output to make sure that baby is getting enough in between. Okay. After that 2 weeks and baby's back to birth weight, if everything is going just swimmingly, we're going to stop tracking the pees and the poops and the feedings. It's going to be, let's just enjoy this process. Okay, we'll talk more about what tracking looks like and how much to expect from your baby. But if your baby is growing, gaining, and has the output, then your body's making enough milk. So your body's going to be adjusting based on what your baby needs. So you may feel more full in the beginning, but as your body adjusts, figuring out how much milk that your baby needs, that's when we're going to maybe not feel as full as we did, because your body understands how much to make for your baby. As long as your baby is gaining enough weight and having enough wet and dirty diapers, then your body's making enough milk. Breast milk has its own rhythm. It's going to peak in the peak volumes. The highest amount of milk that you're going to make is going to be in the middle of the night, which is not super convenient for our normal day and night schedule, but that's when babies are the most active. So you're going to have higher milk volume in the middle of the night and early morning, and then it kind of declines over the day. It changes in the nutritional content. So your baby's getting a different kind of milk at different times of day. So if you were to express your milk in the morning hours and at the beginning of a feeding, it might look bluish white at the beginning of a feeding and more creamy at the end of the feeding, just because we have these different kinds of milk at different times of day and at different times during the feeding. So you're going to see a variety of colors. Your baby will continue in its first 4 to 6 weeks. Your baby's going to continue breastfeeding 8 or more times in 24 hours. Your baby is breastfeeding better, so feedings may be shorter. In the beginning, those feedings can be 45 minutes to an hour, right? Keeping your baby on task, waking your baby up so they don't just sleep at the breast, making sure that they're actually feeding. Then they own it. They know what they're doing. They are on task. They eat, they feed, and then they move on. So we're going to get these feedings shorter. And your baby's tummy is going to be larger, so it's going to be able to hold more milk. So feedings will become farther apart. Okay. As I talked about that kind of rhythm of milk and having higher volume in the earlier part of the day, you're going to see that your baby may not feed as frequently in the beginning part of the day and then start some back-to-back feedings in the evening hours. That is normal to have this baby that just wants to eat a lot in the late afternoon and the evening. So it's a pattern, right? We don't schedule babies, but it's going to be just knowing that it's because of this natural rhythm of the milk that you have different colors and different feeding patterns for your baby. Okay, so getting ready to breastfeed. So we're going to begin each feeding with the 3 C's. So making sure that your baby is calm. Sometimes babies are agitated with a diaper change or they're just ready to eat. So the best thing that you can do is calm your baby by holding them on your chest, skin to skin, just like this picture here, right in the middle of your chest. It helps to keep them warm and it brings them to the table. So putting your baby on your chest right there turns on their reflexes for breastfeeding, and they're going to look for the breast in that spot. So if we bring baby there and they go to sleep, they probably were not actually interested in feeding at that time. It's like they're sleeping at the dinner table. They're like, I'm not interested right now. But if you put your baby here, that usually signals to them that it's time for feeding. They're calm, they're close to their mama, they're close to their home, and they start to calm. So bringing your baby to your chest, right in the middle, holding them close, is going to help to calm them for feeding. Talk to your baby. Your baby knows your voice. It's very comforting. Hold your baby close. So in the position, instead of leaning over your baby, you want to get yourself comfortable and then bring your baby to you. Bringing your baby to the level of the breast. Using pillows to support can be helpful, and just building your nest and getting ready to just kind of hang out with your baby for those longer feedings in the beginning. Get comfortable, sit in a comfortable area, a bed or a chair, and support yourself if you support your back. If you're sitting in a chair, it's nice to have a stool under your feet to bring your lap up so that you can be comfortable. Like I said, at the beginning, the first day, babies, their feedings may be very short. That's where we give drops. We help them get what they need while they don't have the energy for feeding. And then it's marathon feeding, where they want to be at the breast and they want to be there for long periods of time, stimulating that milk production. Then that's when we have those long feedings, and then they get shorter as your body knows how to make milk, your baby knows how to latch and remove it, then those feedings just become really efficient. Okay, so we're going to make sure we feed our babies on demand. I know a lot of times we think babies feed every 2 to 3 hours, but we're going to talk a little bit about what that actually looks like. We want to make sure we feed our baby anytime that they ask for it, on demand. Baby's going to be more settled and content. It prevents breastfeeding complications like engorgement, right? If we're leaving the milk for too long, it's going to help you have a good milk supply. As we remove the milk and stimulate the breast, we tell our body to make more milk. So it's going to help your body to make more milk. Your baby gets the right amount to eat, prevents engorgement. Breastfed babies do not eat on a schedule. Okay. Baby doesn't have a time frame of when to eat. They are not born with a clock. They're not born with a watch. They don't know what time it is. They just know if they have the space in their tummy and if they have the energy to fill it. Okay. So most of us think that babies feed it every 2 to 3 hours, and some babies do. But as we have that rhythm of the milk, we're going to have different time frames for feeding. So we're going to look at an overall feeding pattern. So we want to see that baby feeds at least 8 times in a 24-hour period. So 8 or more in 24. Your baby can feed 10 times, 14 times in a day, but we want to just make sure that at a minimum, your baby is feeding at least 8 times in 24 hours. Now that first sleepy day, that's the only time I'll really want you watching the clock, unless there's an issue. The only time I really want you watching the clock is to make sure your sleepy baby is waking up frequently enough to get at least 8 feedings in a 24-hour period. So if it's been 3 hours and your baby is still asleep, that might be a good time to put him on your chest, bring him to the table, and see if there's any interest in feeding at that time. Okay, and we'll talk more about what a hungry baby looks like, and how to know when your baby's ready to eat. So here at Long Beach Memorial, Miller Children's and Women's Hospital, we room in, we stay together. We try to keep parents and babies together 24 hours a day. The parent and the infant will have a close but separate sleep surface. It allows you to comfort your baby quicker, gives you more peace of mind. This actually helps you get more rest than if your baby went to the nursery. Helps you get to know your baby, learn their feeding cues, learn their body language, and what all their little sounds and movements mean. It facilitates breastfeeding, because it allows for the on-demand feeding, which promotes milk production. You can respond to your baby as soon as they start showing that they may be ready. You and your partner are going to learn how to care for the baby, diaper changes, swaddles. Whenever the nurse comes in to do something with the baby, you can jump right in and take every opportunity to learn. So our goal is to have everything happen in the room, except circumcisions, and sometimes ultrasounds may be done in the nursery. So how do we know if your baby's ready to feed? We're talking about cues. What's a cue? How do we know that babies want to eat? So babies show us different body language that let us know that they're ready. So the best time to feed is when your baby is showing early or mid cues. So early cues, baby's trying to let you know that they're hungry. That's just starting to wake up, opening their mouth, turning their head. We call that rooting, when they turn their head side to side and start to open their mouth. That's when your baby their body is waking them up. Their body's telling them that it's time to eat. So we want to look for those small little movements. Then baby's really starting to wake up. Those mid cues are like, okay, I'm really hungry. They start stretching, they increase their movement. They're bringing their hands to their mouth. Remember, they've been in this tiny little ball, this tight little space, and they practice sucking on their hands. So their hands are very familiar to them. If they start trying to eat their hands, that's a pretty clear sign to you that your baby is ready to feed. Crying is a late sign of hunger. So you want to try to not let it go on for too long. Some babies go from 0 to 60. They're awake and now they're crying and they're mad. So we're going to just calm babies and then try to feed them. Crying doesn't always mean hunger. It can mean a dirty diaper. They need to be burped. They're a little bit gassy, or they just want to be snuggled. They want to be close. They want to be nice and warm. So bringing your baby to your chest where they get the snuggles, you can burp them, you can help them with gas, giving them that comfort. Then you get to calm them and see, are they going to move into I want to eat, or are they going to fall asleep? So bringing your baby to your chest is a really great way of having that nonverbal conversation with your baby of, what do you want? What do you need? Let me bring you to my chest and you can tell me exactly what it is. And you look for that I'm just gonna be calm, but I'm still trying to eat my hands. So if the baby is upset, crying, fussy, we want to calm before trying to feed. Okay, so coming up next is going to be positioning and latch. So if you want to take a moment, you can pause the video here, grab a doll or a stuffed animal, and we can follow along. Okay, so we're going to talk about positioning and latch. Babies are born to breastfeed. So let's just keep that in the back of our mind, right? Babies have reflexes. They have different, they know to open their mouth. They know to suck. But putting all of these things together and learning how to latch is actually it's a learned response. Babies know how to root. They open their mouth. They know how to suck. But opening, latching is something that your baby will need to practice. Proper positioning and latch are essential for successful breastfeeding and helps your baby get enough breast milk, helps you to have enough milk for your baby, and helps prevent nipple pain and damage. So some parents expect breastfeeding to be painful, and it can be painful if your baby's not latched correctly, but we shouldn't expect latching to be painful, okay? So there's lots of different holds that you can do, different positions. There's no correct position on how of how to breastfeed. Every breast is different, every baby's different. So we want to work on different positions to get you guys all comfortable and deeply latched. So a deep latch is the most important thing. There's different pillows that you can get. Use what you have at home. If you're going to get a boppy or a breast friend pillow, you'll have all these different pillows you can use. You probably won't need to bring it to the hospital. We have pillows here that you can use. Not specifically breastfeeding pillows. We use the hospital pillows. But the postpartum tummy does not go down right away. And if we use a boppy pillow on top of the postpartum tummy, they usually get a little more in the way than anything else. And again, deep latch is the most important thing. We want to make sure that your baby has a nice, big, open mouth, latched fully to the breast and not just the tip of the nipple. The milk is in the breast, not in the tip of the nipple. The nipple is the exit vehicle. Okay, so if we are squeezing the tip of the nipple, that's where it's going to be really uncomfortable for you and not as effective at getting the milk out. So we want to make sure that your baby is deeply latched. That means they have a lot of breast in their mouth. That's going to help them move the milk more efficiently and make you comfortable. Okay, so if it doesn't feel right, listen to your body and ask for help. Okay, so here's some pictures here, the deep latch technique. Supporting your breast using a C hold. Nice to use a C hold because your fingers are out of baby's way. You see here, if we are holding the breast, baby can latch over to the entire areola or as much as they can get in their mouth. Areolas come in varying shapes and sizes. Some women have very large areolas, some women have very small areolas. So it's hard to say how much of the areola is going to be in your baby's mouth. Just know it's as much as they can get, okay? So using a C-shaped hand allows your baby all of this space to be able to put their mouth. If we're holding too closely, we're trying to offer the nipple like this, or we're holding the breast like this, we're really limiting the space that baby has to get their mouth over as much areola as possible. So if we can keep our hands out of the way, we can offer the breast, shape it as needed. We don't need nipples that point out super far. Some women have nipples that pull a little further back. That is okay. We are just going to create a ledge for your baby to get up and over. It's breastfeeding, not nipple feeding, okay? And your baby doesn't get to shop around. They're going to learn how to latch to your breast, okay? So using a C-shaped hand is going to be very helpful to keep your fingers out of the way. So then we're going to support the baby's head by supporting the neck, okay? A lot of us think we want to hold babies from the back of the head, right? But holding the back of the head is going to restrict your baby's movement, right? It's going to make it so that they keep their chin on their chest. And if we think about drinking a bottle of water, it's easier to drink if our chin and our neck and everything is up and extended. So we want to allow your baby to extend their neck back. My baby doesn't really extend very far. But we don't want to put our hand back here and make it so that the chin is down on the chest and then baby can't do anything. But we want a big open mouth. So the head tipped back is what we're going to want to do to help make that space between the chin and the chest. So holding at the base of the neck, fingers either at or under the ears. I like to put my fingers alongside of baby's jaw here, because then if we're holding baby at the side, we have the weight of their head in our hand, but we're allowing them to still move their head back. Even if we put one finger of support on the back of baby's head, some babies will feel that pressure on the back of their head and they push towards that stimulation. They push backwards, which makes it look like they're resisting latch. They're pulling away from the breast, but it's because we are confusing them with the pressure on the back of their head. So moving all fingers under the ear is going to be a super important starting step. Okay, so supporting the baby's head by supporting the neck and giving them space to move their head back. So when we stroke the nose, the upper lip. If we have a baby that gets close to the breast and immediately is opening, that's really great. You don't have to do a whole lot other than be ready for it. If you have to get your baby interested to open, sometimes stroking from nose to chin and really hitting that chin, it's going to stimulate them to open big. So tapping the chin, stroking nose to chin is going to help your baby know that it's time to open. We are close. The breast is right here. When your baby gives you a big wide open mouth, we want to make it like a yawn. If you see your baby yawn, you know how big their mouth can go. So we want to see that big open mouth. And then with your supporting hand, the hand holding your baby, you bring baby in towards the breast, not the breast towards the baby. Okay, this takes practice. We want to feed our babies, so we're going to try to put the breast in their mouth. We want to align the breast, pointing the nipple at the nose, which I'll show you why we do that, so that when baby opens, we're going to get a nice deep latch. So when the baby latches on, they will have all of the nipple and most of the areola in their mouth, if not all of it. This will give your baby more milk and you will both be more comfortable. Okay, I'm going to stop sharing for just a moment so that I can have you see a little bit closer what that latch is going to look like. Okay, so I have my little puppet here that's going to help us see this latching. Okay, so I only got two hands, right? But we're holding the breast with a C-shaped hand to offer all that space for baby to latch to, right? It's not nipple feeding, it's breastfeeding. So we want to have baby on as far and as deep as we can. So holding with our C-shaped hand. And if we're supporting our baby, we're holding at the base of the neck, not the back of the head, right? We're not doing this. We're not doing this. We're under the ears or at the ears so that baby can tip their head back. We don't want chin down on the chest, right? They're not gonna be able to open as big. We want to have space for a big open mouth. Okay. So now when we aim our nipple, right, or align our baby, we want to make sure that the nipple is across from the nose. And it seems so super silly when you think we're feeding a baby. Why aren't we pointing here? Okay, let me show you what happens. If baby tips their head back, opens, we bring them in. Oh, now we've got the tip of this nipple and that super hurts. It doesn't feel good. And baby doesn't get as much as they should because the milk is not in the nipple. The milk is in the breast. And we need baby to be able to compress those ducts that are further back and use their tongue to strip and pull the milk. So now if we aim at the nose and we stimulate baby to open, we're saying open, grande, whatever you need to cue your baby, because they do learn very quickly. Tell your baby open, open big. When they tip their head back to open, now we bring baby straight on and we've got this big mouthful of breast with that lower lip engaging first. Okay, so we want that chin, really jut your baby's chin out so that you can stimulate that open response, which is the chin does that. So if we can get the chin in first, we stimulate that open and then we bring baby to you all the way up and over. Okay, so we're aiming at the nose, let baby tip their head back, and when they open, bring baby kind of straight on, up and over. Think of a gourmet hamburger. We might smash it down a little bit, and it's a 2-point landing, up and over. Okay, so same thing with your baby. So aiming at the nose. When baby opens, we're stimulating, that chin stimulates your baby to open, then we bring baby to you, not the breast to baby. Okay, I hope that helps a little bit. We'll talk more. Let me go ahead and share my screen again. We'll get back to the PowerPoint. Okay. So the signs of a good latch, what are they? Okay, so we're going to see baby's lips are flanged out. That means they're out there like a fish, like a pouty lip. I want to see that lower lip looking like a good pout. The upper lip can be neutral or flipped out, but the lips should not be tucked in. If the lips are tucked in, don't be afraid to just gently pull your baby's lip out, untuck it so that we have no pain, little speed bumps with the way that when those lips are tucked in, it can be really uncomfortable. So don't be shy to use your free hand or a free hand of your partner to just flip those lips out, okay? The tongue needs to come over the bottom gum line. That bottom gum line is where those first two teeth will come in. So we want to make sure the tongue comes over that, right? Protecting the breast from those teeth. That's future. Don't worry about that right now. Some very, very few babies are born with any teeth at all. They usually just have gums, but we want that tongue to come over that bottom gum line and cup the breast, because it's the tongue moving and undulating and stripping the milk that helps pull that milk forward and create that vacuum that suctions the milk out of the breast. So we want to make sure that that tongue is down and forward. When a baby cries, their tongue usually goes to the roof of their mouth. So we want to make sure that when baby is calm, that they are opening their mouth and that tongue is coming forward. Another sign of a good latch is that baby stays on the breast. They're not slipping off. There's no pain, no pinching, no biting sensations. Your nipple, most nipples are quite round, sometimes a little bit oval shape, but it should be the same shape going into your baby's mouth as it is when it's coming out. If you're getting a nipple that is ridged or pinched or looks like a lipstick, it is not a deep enough latch and we are compressing the nipple. How do we know if babies are eating? So we want to watch for visible signs of swallowing. So that jaw, I hope you can see, let's see if we can do a little pointer here, laser pointer. The baby's jaw, you should see movement all the way to the ear as that baby pulls that jaw down. You'll see movement all the way to the baby's ear. As the baby's jaw moves down, it'll go big, big with every suck. When it drops even bigger, open, big open mouth, that's when baby is taking a swallow of milk. So it takes some practice of watching babies suck and swallow to be able to identify what a swallow looks like, but you can ask your nurses and your lactation consultants to help you identify your baby's swallows. But watching for big movements of the jaw is going to let us know that baby is actively feeding and passing milk. You might hear swallows. It might sound like a little puff of air, a little as baby takes a breath as they swallow the milk. You may not hear a lot of swallows in the beginning because the milk is so thick and sticky. It takes a lot of sucks to build up enough volume for one swallow in the beginning. And then as that milk volume climbs and increases, it's a suck, swallow, and you may even hear gulping. Okay. So guidelines to proper positioning. You and your baby are chest to chest. Your baby's ear, shoulder, and hip are in a straight line. Your baby's body is close to yours. No swaddles. We want to get baby and get the clothes off too. More skin to skin is better for your baby's brain development and immune system development. So we want to take the clothes off, keep the diaper on, that's fine. But getting as much skin contact as possible is going to help your baby to be more stimulated throughout the feeding, more engaged, less likely to just drift off to sleep, which they do in the beginning. And just getting your baby as close as possible. That's going to help you get your deepest latch. If you have your baby swaddled with their arms in front of them, that's so much in the way of getting your baby chin deep to the breast. Okay, so we want to make sure that we are taking all the barriers away from between the two of you. and having the tummy facing your tummy. So if we have, let's see if we can see over here. If baby's tummy is facing up, for baby to latch to the breast, they have to turn their head to the side, okay? Now, if we turn baby's tummy to you, tummy to tummy, then baby is facing their food. We can put one arm on either side of the breast, okay? So I hope you can see how that looks, right? Baby's gonna face straight. They're gonna be able to get a deeper latch. But if baby is tummy facing up, that turns their head to the side, right? Baby's tummy's here. Now they have to come at the breast from a completely different angle, and that makes it more challenging to get a deep latch. We're supporting the baby's head by supporting the base of the neck, not the back of the head. Baby's nose is opposite the nipple, right? Lining up the nipple to the nose, and baby's chin is deep into the breast. I want you to let that chin come off the chest and push that forward to be your starting point. Okay, so we're going to go through kind of the same positions that they went through in the video. I'll go through what those look like. I know I'm a tiny box in the corner, but I want you to be able to still see the slides and see the image on the screen. So I'm going to stay a little box for now. The laid back position is where it's just like what it sounds like. You are laid back. It's an instinctive position because that baby being right on your chest, them face down, but not nose down, right? Having them on your chest stimulates those reflexes for breastfeeding. So it's more instinctive. If your baby is really sleepy and difficult to get interested in feeding, laying back can help turn on those reflexes a little bit. You let your baby snuggle into your chest. Gravity helps them stay close. If you can see in this picture here, gravity is holding baby onto mom, right? It brings that chin forward. It's the first point of contact. Babies will lift their head and look around, and they're going to be able to use gravity to help them. The cheek will be close to your breast. This allows your baby to start rooting and looking for the nipple because they feel the stimulation on their cheek and they follow that to try to find the nipple. That's another one of their natural instincts. You just support the baby with your arm on the side. Relax, let your baby seek, let them follow their instincts, and you can gently guide them. This is commonly used right after delivery. If you have a spinal headache and you need to lay flat, this position lets baby take the lead and allows you to be comfortable laid back. Just be comfortable. When we follow our baby's lead, it allows you and your baby to use their natural instincts. So stimulating those reflexes, hitting the chin tells them open the mouth, touching the cheek tells them go this way. So allowing them to just kind of cue into their natural instincts a little bit more. This is helpful if you have to lay flat, or if your baby just needs to kind of be more awake, more stimulated. This is also helpful in the future if when your milk volume is higher and your milk lets out really fast. Sometimes babies have a hard time keeping up with how fast the milk flows. So laying back just makes the milk travel uphill. We use gravity to our advantage in that instance too, because now the milk has to travel up instead of gravity and a fast flow just pouring out at the baby. So if you have a lot of milk and your baby's having trouble keeping up with how fast it comes out, try laying back. It can help. Okay, so under the arm or the football or clutch hold, however you call it, this one is a really great for C-sections, or if you have very large breasts. It puts baby at the side of your body. So it gives the baby good trunk and head support. You can help support their shoulders and their buttocks so their lips can find the breast more easily. The baby really comes in from the side of the breast. It gives you a good visual of what baby's doing, especially if you have a large breast, because it brings baby right at the side of your body. You can see everything happening right there. It's good for a preterm baby, a small baby, or a baby that just is a little bit weaker. They have lower tone. It's going to help baby attach to the breast a little bit more easily. Okay, so I'm going to quickly stop sharing so that we can demo again. Okay, so I'll show you kind of those two positions really quickly. So we'll be in a chair. You can lay back. Baby can come to you. and find the breast, and you can gently guide baby or guiding with the breast to allow baby on, but just laying back, be comfortable and let your baby do their natural instincts, follow their lead. They're going to lunge and lift their head and looking for the breast. Okay, so this one, ask for some help. It's a hard one to do by yourself if your baby is not very active. So asking for help, getting yourself comfortable, and just following your baby's lead. So that's kind of laid back. It's one you'll have to practice and try with your baby. And then with the football hold, I really like the football hold, especially if you have, like I said, large breasts or have had a C-section, but it just really brings your baby into a really visible location for you. Okay, so I like to put the first flat hospital pillow folded in half right at your hip. And now if we are trying to be comfortable in the bed and we've got this pillow over here, this gets in the way of baby's legs. So the other pillow, any supporting pillow you have, you want to turn vertically to keep out of baby's way. Okay. Now I'm going to use this pillow because this is not high enough for baby where my breast is, right? So we want to bring baby up to the level of the breast. And it looks really high, like, whoa, this huge pillow table up over here, right? But we want to bring baby to where the breast is. It takes some of the pressure off of you holding your baby for long periods of time too. So it just helps to have a nice tall pillow table. Okay, so we want to bring baby to the level of the breast. So in this position, you may have to have your baby's little legs tucked up nicely, butt up on the bed. And remember what we said about tummy up. If your baby's tummy is up like this baby's is, you see how they have to turn their head to the side to latch? So we are going to help our baby out by turning them to the side, allowing both arms to be on opposite sides of the breast so that baby can do the latch in this position, okay? And remember, we want chin off the chest. So baby has to go far enough back to be able to extend their head back to get onto the breast. So if you have your baby really far forward and their chin is down like this to latch, they're not going to get that big open mouth. So you're going to want to make sure that you move baby back far enough. And then we're supporting baby at the base of the neck, C-shaped hand over here, and aiming that nipple right across from baby's nose, okay? So that is the football hold and the laid back position. So we'll come back into the screen share. And we'll go over a couple more things for us here. Okay, so the cross chest, cross cradle, cradle, however you want to call it, these are two different positions. The cross chest or cross cradle is a really great way of getting into a cradle hold without starting from a cradle hold. The cradle itself is a little bit more of an advanced position, I guess I would say. It's something that you're going to use if you're very familiar with breastfeeding, your baby is really familiar with latching, and that usually just comes with time, okay, or subsequent babies. And even subsequent babies still have to learn how to latch. So the cradle hold, you don't have a whole lot of control over what baby is doing, right? So if baby tips their head back nicely in that hold, you're able to just kind of hug baby in closely. Some babies and some parents can latch perfectly in a cradle hold from the beginning, but it's not as common, okay? So the cross chest or cross cradle allows you to play a little bit of a more active role in bringing your baby onto the breast. And then you can switch arms around which one's holding your baby, and you'll be able to then cradle your baby and get comfortable, okay? The cross chest or cross cradle is not my favorite for hanging out for a long feeding because it takes away both of your hands. If you can see in this picture here, her hands are tied up completely in holding her breast and holding her baby. So if we start in this position, it can help you get your baby on latch nice and deeply. And then this arm wraps around baby. You see how we have to kind of switch here. Let's see, this arm will wrap around and then this hand gets to come out. So then we have a free hand to be able to stimulate the sleepy baby or compress the breast to help move the milk. It just helps you get a nice deep latch, and then you get to get comfortable, okay? So let me show you kind of what that would look like We're going to stop sharing again for a moment so that you can see. Just 1 second here. Okay. So if we are doing a cradle hold, we want to make sure that we're keeping the pressure off of the back of baby's head. We're going to have to move some of these pillows because I want to be able to drop my elbow. You might have a little bit of support, but overall you want your shoulder relaxed, not up here, because baby's nose gets buried in the breast when we do this, right? And their head just goes in, their chin goes to their chest, very pinchy, okay? Hard to get a deep latch. So if we're able to drop our shoulder, drop our arm, then baby's head can tip back over our arm. We're supporting the back and the butt to keep baby's body close, allowing their head to tip back so that they can breathe, but also so they can get that chin deep and get that big open mouth. Okay, so we want that head to be able to tip back. So allowing that, then when you line your baby up, this is where you're just gonna scoop baby on with a quick little hug, okay? Now, if your baby's not able to do that, like I said, it's a little bit of an advanced maneuver. Baby is taking a lot of an active role. If you need to take a little bit more control, baby's pinching your nipples, you want to take control of your nipples, that's when we're going to do kind of what we did in the football hold, where we're holding at the base of the neck, right? Let's just pretend we're going to be on the other side now, okay? You might put a pillow in front of you to help hold the support of the baby's body. Remember, baby has to face you, tummy to tummy, note up tummies. We don't want arms in the way, right? So arms are going to go on either side of the breast. So tucking one arm under, turning baby's hips to you. So hips and everything this way, and holding at the base of the neck, okay? This way, with my C-shaped hand around my breast, I can guide my baby onto the breast. Once everything, okay, baby's on, it feels good, looks good, baby's actively feeding, that's when you're going to scoop this arm around. This hand is going to hold your baby. Now this hand gets free to be able to maybe squeeze and help move the milk. You can stimulate your baby like, hi, it's feeding time. Please don't fall asleep on me. So this is going to give you a hands-free. Maybe you check your phone, call the nurse, take a bite of something, right? We don't want you to be held up like this throughout the whole feeding. It's just not super sustainable. Okay, so those are the cross cradle, really cross and then cradle is my favorite position, just because it gives you more of an active role and helps you take charge a little bit more of your nipples. Okay, we'll get back to the slideshow. Just give me 1 second here. Okay, so we are going to talk a little bit about the sideline position. This is a really good one for if you have a lot of damage or pain from a vaginal delivery. This helps you get off your bottom and just lay on your side. We don't see it a whole lot in the hospital. We are starting to use it more and more. Making sure that you're awake. If you're super sleepy, this position is just going to make you fall asleep, and then that can be dangerous, right? So we want to make sure that we are not super sleepy. Again, lining your baby up so that their chin is off their chest, nose is across from the nipple, and then just quickly bringing baby to you with your free hand. This one is a little bit challenging to do by yourself because it takes one of your hands away, right? We're up here supporting our own body. So bringing your baby to you, make sure you have somebody with you while you're practicing to see if you can get that kind of movement down. This is really nice during night feedings. You have your baby in their separate sleep space. You bring them to your bed to do a feeding, making sure you are alert enough, or you have an alert adult supervising. And then when you are done breastfeeding, baby goes back to their safe sleep space. So practice that position during the day so that you can be more successful with it at night. And I know that I had mentioned that a lot of people think that breastfeeding is painful, and pain is not normal. That's your body telling you, sending you a message that something's not quite right. And we've got to make an adjustment because this is not going to be as effective or efficient for either of you. Okay. So if pain is not normal, listen to the signals from your body and make adjustments. So if the baby is not latched on well, you're going to break the seal and start again. Okay. And the way that we break the seal, because babies are latched on with suction. Okay. If we just pull babies off, then we pull that breast tissue with suction away while baby is unlatching, and that can cause nipple pain and damage too. So using your pinky finger, your pointer finger, whichever finger you can get into the side of baby's mouth, like a little fish hook, making sure that we have clean hands, sticking your finger in baby's mouth, it breaks that suction and then you can pull baby away. Okay. So consider cutting your fingernails, taking off artificial nails, having clean hands, being ready to be hands-on, hands in your baby's mouth as needed to be successful with latching. So a lot of parents get their nails done for their baby showers, and then they have these big long fingernails and they're like, I can't put my finger in my baby's mouth. It's not clean and it's too long. So consider having short, clean fingernails for when you have your baby. And latching, like I said, is a learned behavior for both of you. We don't see breastfeeding out in the wild. We all cover up. We don't show it, right? So we want to learn this skill of something that we may have never seen before. Okay, so be patient with yourself and your baby. This can be a steep learning curve depending on how things are going, but just ask for help and know that babies do learn very quickly. They just need consistency and repetition. So if we are telling them, not like that, not like that, not like that, they get the message faster than if we sometimes let them be a little shallow and it hurts, but we're feeding our baby, but it's not really effective. We want to make sure that we're consistently showing them, this is your spot. This is how you do it. This is where you need to be. So getting your baby latched deeply is going to help send that message quicker. So if it hurts, take baby off, start again, do the sequence again. It helps you learn, helps your baby learn. Okay, so we're going to talk a little bit about newborn behavior. So right after birth, infants are usually very alert. They can see about 8 to 10 inches, which is really convenient because that's about the same distance from the parent's face to the breast. That's why the nipple and the areola get bigger and darker, because babies, they can see, but they see in high contrast. So your nipples become like your areolas become like a target for babies to see. Babies can smell you. They have a very strong sense of smell after delivery. And there's little bumps on your areolas, that if you've noticed those yet, there's tiny little bumps that are actually called Montgomery glands. They secrete a substance that protects and lubricates your nipples. And it smells like amniotic fluids. It's literally the only smell that your baby's familiar with in the whole world. And the breast is emitting that smell. So we want to make sure we're limiting nipple creams, right? If you need to use nipple creams, use it right where you need it, because we want your baby to be able to smell the natural scent of the breast. Your baby can hear you. Your baby recognizes the sound of your voice, and it is the most comforting thing. Time and time again, I'll have a baby that's a little bit fussy. They're having trouble calming down. And as soon as the parent starts speaking, they start to calm because they feel comfortable. It's familiar. They know where they are. They can feel you. Newborns like to be close. They can feel the vibration of your voice, just like they did when they were inside. And they can breastfeed. They're born to breastfeed. So, and they breastfeed better when held skin on skin. And they also breastfeed for about 6 weeks longer when they do more skin to skin breastfeeding in the beginning. So let's make sure we allow time for that. So right after birth, most babies are very awake and alert. They recognize voices and smell. They have strong instincts that they want to breastfeed. The breast milk is going to coat your baby's tummy. That colostrum, that first milk, is super, super thick and nutrient dense, and it helps to protect and start their digestion. So colostrum is just, it's super milk. It's like protein bars. The more colostrum your baby gets, the more poop you're going to see in the diaper. And yes, that's a good thing, because babies are born with livers that are not fully developed yet. And they have extra red blood cells that their liver has trouble kind of processing. So they can develop what we call jaundice, which is just a lot of this extra red blood cells, where some amount of jaundice is normal. If it gets too high, then that can be a problem. The way that babies get rid of jaundice or those extra red blood cells is in their poop. So the more poop we see, the more well-managed that jaundice level is going to be. Okay, so colostrum has a laxative effect and it really gets things moving. But right after delivery, this is your baby's probably going to be your baby's best feeding for the next 24 hours. Because then after the first hour or two, the baby might sleep for 6 or more hours. We keep them skin to skin and near the breast. Your partner can do skin to skin so that you can rest while baby's resting. Keep things calm, dim the lights, limit the noise, and limit visitors. Okay. I feel like I can't say this one enough. We're all so excited to have our nearest and dearest come and meet the baby. But having too many visitors, especially people that you are not comfortable with exposing your body to, right? I've had parents that they withhold breastfeeding for too long because they're uncomfortable with the people that are in the room, or they limit feeding because they don't like the visitors get there and they're like, oh, let's hurry up and cover up. I don't want them to see me breastfeeding. So making sure that the people that you allow to come into your hospital room, I mean, we all think about the labor room, the delivery room, who do we want there when everything's on display, right? We think about that, but thinking about who you actually want to be there when your shirt is off and you are exposed and you're learning how to breastfeed. You want to feel super comfortable with the people that you have there. And you may want to just ask people to wait and meet and see the baby at home, unless they are very near and dear and they are coming to be helpful. Okay. And that can just look like holding your baby while you rest. So feed your baby whenever your baby wakes up. So remember those feeding cues. We're watching for your baby to show us that they are ready. But just know in that first 24-hour period, your baby is going to be sleepy. Your baby may sleep through feedings. That's where we're going to put them on the chest, give them drops of that colostrum with that hand expression that we talked about, and just giving them as many as you can, right? You can go back and forth between the breast, collecting drops, and just with your finger, wipe the drop and put it right inside your baby's lips, okay? And we'll talk a little bit more about how we can give your extra milk as you express it, but just know that your baby is going to be super tired for the whole first 24 hours after that initial awake period, those first 1 to 2 hours. Then your baby's going to be a super sleepy, sloppy breastfeeder. And a lot of parents are very concerned by that behavior, but it is normal. Now, after the first 24 hours, when baby hits that second night, so that high suck need that babies are born with really kicks in. Okay, so the first 24 hours, they're super sleepy, sloppy breastfeeders that maybe don't want to feed at all. And then almost like clockwork, after they hit that 24-hour mark, they start to wake up. They realize they are born. They may be overly stimulated. There's lots of noises. They've been poked, they've been prodded. They may have had some procedures done. That's when babies want comfort. They want to be close and they want to feed frequently. Okay, so their tummy size is super tiny, right? The size of a cherry when they're born. And then as it starts to grow and they start to poop, their desire for feeding goes up. Okay, so if you have a baby that was super sleepy the first 24 hours, it's okay. It's coming. The latching practice is coming. The cluster feeding is coming. So night number 2, babies who are nocturnal, their days and nights are backwards. Babies like to be awake at night, but remember, we have higher milk volume at night. Okay, so that's normal. Your baby's going to want to be up all night working on latching, wanting to suck. They're putting their order in for their 3-day shipping, right? That tummy is going to be the size of a walnut by day 3. And with all of the sucking and all of the milk removal that your baby does, your body receives the message that it's time to make more milk. Okay. So on night number 2, babies may be feeding even every hour. We call it cluster feeding. There's no schedule. So it's going to be on demand whenever your baby wants. Sucking is soothing and your baby gets lots of colostrum that way. So making sure that your baby feeds whenever they show you that they are interested, and lots of skin to skin. Okay. We're going to avoid pacifiers during this time. Really, the first 3 to 4 weeks, we want to make sure that we just work on breastfeeding. First of all, I think you've all heard about nipple confusion, right? We don't want to have babies looking for really firm texture of plastic right up on the roof of the mouth that stimulates sucking. Then we bring in the soft breast that doesn't hit the roof of the mouth may be the same. And some babies have a hard time, like, well, where is it? Why is it not hitting the way I expect it to? So then we have babies that have a hard time latching when we use pacifiers, especially when they have not established that breastfeeding is how they feed. Okay. So babies have to tell your body how much milk to make, and they do that by frequent sucking. They do that by frequent feeding. If we give them a pacifier instead of an opportunity at the breast, it's potentially a missed feeding, and baby may not be getting enough, and your body may not be getting stimulated enough. Okay, so super important that we make sure that we are not giving pacifiers in the beginning and that we're latching our baby on demand. Night number 2 is when most parents will question if they have enough milk for the baby, just because the feeding can be so frequent. Okay, but as long as your baby is having enough pees and poops, then we know that your baby's getting enough, and what they are doing is just a normal newborn behavior. Okay, I'm going to talk about what a feeding log looks like and how much output is actually expected. So hold on for that. Okay, so growth spurts. Babies have predictable time frames for when they grow. So night number 2 is kind of their first adventure in growth and telling your body how much milk to make. But then you're going to see it happening around 2 weeks, 6 weeks, 12 weeks, where baby will have a few days of just hungry days. Like, oh my gosh, my baby is just eating all day today. But as they grow, they need more milk. So they're going to drink more milk at age feeding. And that frequent emptying of the breast tells your body, hey, we used all that milk. Well, let's make more. So it tells your body to make more milk for your growing baby. So during these growth spurts, your baby may be more fussy and wanting to feed more frequently. Take a little baby moon, Netflix and chill. Just know that you're going to be sitting at home getting what your baby needs, right? So lots of breast stimulation, lots of milk removal is going to stimulate higher milk production. Okay. So your next growth spurt that you're going to be watching out for is going to be around 2 weeks. So we know night number 2 and 2 weeks are going to be those initial growth spurts where babies have to put in more time at the breast to tell your body to make more milk. So keeping track of the pees and the poops. So I talked about earlier how most babies will lose weight the first few days. Remember, they're born full of poop. Then that poop starts coming out, but that poop is part of their birth weight. So it's normal for babies to lose some weight in the beginning. And there's a threshold that your healthcare team is comfortable with. And we will be the first ones to tell you if your baby has lost too much weight, but we can expect some weight loss. Okay. It is normal for your baby to lose weight. So how we know if baby's getting enough is by keeping track of their pees and their poops. Okay, so you're going to get a book that's going to look similar to this one. It may not be exactly this book, but when you get into your postpartum room here at Memorial, you'll get a book. Somebody's going to show you what the feeding log looks like, and it looks like this here that I have a picture of. So the feeding log is a great way of keeping track of your baby's feeding and pees and poops. And if we keep it, that just gives you the knowledge and the peace of mind that your baby's getting enough. Okay, so let's go over really quickly how to use this log and how to keep track of your baby's output. So let's say your baby was born at 12 noon, middle of the day, smack dab in the middle. This is what time your baby's 24-hour clock starts at. Our day starts at midnight. Your baby's day starts at their birth time. So let's say your baby feeds right after delivery. We would put a circle right at 12 o'clock, maybe 1 o'clock. Okay, circle the time that your baby feeds. Then we're going to continue doing that. Maybe we had to wake our baby up, put baby on the chest, do some drops of milk around 4 o'clock. And then we keep going on. Anytime that your baby feeds or attempts to feed, you're going to put here and maybe how many drops you gave. If you gave 15 drops of colostrum, write it in the little box below and take credit for it. After midnight on that first day, since our baby was born at noon, we're going to wrap back around to the beginning of the line to keep tracking your baby's first 24 hours, because your baby's 24 hours are not done until they've hit that birth time. Okay, I hope that makes sense. Rewind it, listen to it again. Okay, but your baby's birth time is what time that 24-hour clock starts. So then at the next day, when we hit noon, Then we go down to day number 2, and your baby's second day is going to start. Okay, so going through, and we're looking for 8 or more feedings in a 24-hour period. So if you have started at noon, circle, 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 all the way around, continuing to circle your hours, at the end of the day, you count all your circles in a straight line. You know how many feedings your baby got in that 24-hour period. It's also going to help you learn your baby's pattern of feeding, where maybe your baby fed every hour overnight and then gave you 1 4-hour chunk of sleep in the morning, 6 to 10 a.m. maybe. If your baby had a party all night long and wants to sleep a little bit longer in the morning, that is totally normal. But babies will not likely have more than 1 4-hour stretch of sleep a day. They should make up for it later too, okay, where they do that back to back to back feeding again. But if they give you 1 4-hour stretch a day, take it, get some rest, as long as you know your baby is going to continue on that pattern, okay? So looking at a full 24 hours from your baby's birth time is how we're going to keep track, okay? Now, talking about output, how many pees and poops your baby has is how we know that babies are getting enough. So keeping a log gives you the peace of mind that your baby's on track. Counting the baby's day from the time of their birth is where you start. And in the first 24 hours, your baby needs to have 1 pee and 1 poop. So if your baby's born at noon and they don't poop until 8 o'clock the next morning, they are still exactly where they need to be, right? We have one pee and 1 poop, and the whole first 24 hours is all your baby's expected to have. Day 2, it's 2 pees and 2 poops. Day 3, 3 pees and 3 poops. So we go up every day. It kind of goes hand in hand with which day you're on. If we're on day 3, we want 3 of each. Day 4, we want 4 of each. It's going to continue that pattern until about day 5, and then we want 6 to 8 pees and 3 to 4 poops every day after day 5. So then that's when we settle into a pretty normal rhythm of 6 to 8 wet diapers, 3 to 4 poops every single day. Okay, that first poop is going to be black and sticky, and then it's going to loosen up, change a little more green brown, and then by the 5th, somewhere between the 5th and the 7th day, we're going to have yellow seedy baby poop. Okay, so expect it to be black, sticky, and then it's going to transition to a yellow seedy baby poop usually by the 1st week. That's all that old poop that they're born full of has now come out and is replaced with fresh milk or fresh poop. So if that's happening, then we know that baby's getting enough. So first of all, they need to be having enough coming out, and the poop transition in color from that black sticky to yellow by the end of the 1st week. Okay, so when to get help from a lactation consultant. So common follow-up issues that occur during the hospitalization that may need follow-up when you go home are jaundice, right? Jaundice goes down when babies are able to poop more. So a very easy thing that doctors will do to help get your baby pooping more is to supplement. Sometimes we supplement with your own milk. Sometimes we supplement with formula. And sometimes we supplement with human donor milk. We have pasteurized human donor milk here at the hospital that, as of this recording, is available. So make sure that you ask for that. That's one way to make sure your baby still gets breast milk if your baby needs to be supplemented. So that's something to consider, human milk for human babies. But if your baby has jaundice and we start you supplementing, then we're going to start you pumping. Now we've added in all of these interventions. And how do we get back to just breastfeeding? Okay, that's when we are going to make sure that you're following up with a lactation consultant. So if we have jaundice, if we have latching issues, if we've started using a nipple shield is a little plastic, or I believe silicone barrier that looks like a little false nipple that's going to go over the breast. That's kind of like training wheels. So it's going to help a baby that's not latching well to the breast, may help them latch a little bit better. But that's when you want a lactation consultant to get involved to help guide you in, first of all, using a shield appropriately, and getting off of a shield, because the goal is to breastfeed without any additional tools if able. Okay, so putting a nipple shield on properly, we don't just wear it like a hat. If we wear it like a hat, then baby doesn't get any deeper to the breast and we can continue traumatizing the nipple. Okay, so it has to be applied to the breast with suction so that it pulls the nipple up into the shield. Okay, I don't know if you can see that up here. but that way baby can get on deeper to the breast. So if we're having latching issues and we've introduced a nipple shield, those two things right there, we need to have a lactation consultant already involved, okay? If your baby was born early, but not so early that they had to go to the NICU, you definitely want to follow up, because some babies that are born a little bit early, they need a little extra support. They are sleepier, they don't feed as well. And so they just need a little additional support while they are still growing and learning and gaining weight before we can let them exclusively breastfeed. Okay. Now, after you've gone home, if your baby's not gaining weight as we expect them to, remember, we need to be back to birth weight typically by 2 weeks. If your baby has not met that milestone, or they're not having enough pees and poops, we want to have you seen by a lactation consultant. If your latch is still painful, because sometimes babies come out, they're chomping, they don't know how to do this, they are not opening wide, we have a weird sucking pattern, and we have some sore damaged nipples, and that latching doesn't get better with time, right? By the end of the first week, I expect nipples to be healing if they were damaged in the beginning. And I expect things to be getting better, not worse or staying the same, okay? So we want to seek follow-up care if we have persistent painful latch, or if when that milk volume goes up, we have new sore or damaged nipples after that increase happens, okay? So asking for help for a lactation consultant in the hospital is something you just need to tell your nurse, hey, I think we need a little more support. Can we get somebody from the lactation team here? And that's great. We're happy to help. If your baby was in the NICU, you'll get support there. Definitely want to be seen by a lactation consultant after discharge. Get your baby back to breastfeeding, or as much breastfeeding as possible. We do have a lactation clinic, and I will go over more of that information towards the end. Okay, so alternative feeding methods. If your baby can't latch, we have other ways of feeding your baby that we want to avoid a bottle in the beginning if possible, okay? Most tiny, brand new little humans are going to like fast, easy calories just like the rest of us. And if we have a baby that we start bottle feeding right out the gate, they're going to expect the breast to flow the same. And if the breast doesn't flow the same, then the baby can get a little bit fussy at the breast or refuse the breast altogether. So we want to make sure that breastfeeding is really well established before introducing a bottle itself. Even if it's breast milk in a bottle, it's still a bottle that can deliver higher volume of milk to the baby than they need, and certainly much faster than the breast can flow, especially in the beginning. So we have, that nipple confusion, right? With that firm texture on the roof of the mouth gives a clear signal to latch and feed, where the breast is softer. And then we have this really rapid flow of milk that babies want, that fast, easy milk. There's very little work that has to go into it. So babies are looking for that fast flow from the breast. And then they can overeat very quickly on a bottle. So we want to make sure that if we do have to give a bottle, that we're being very conscious of the way that we do that. Okay, so the first alternative method that we have is with a spoon. Nothing special, just a plastic reusable spoon, or a disposable spoon, but we can wash and reuse it, where we would collect those drops of milk. So if you have teeny tiny little drops that we're just going to wipe with our finger, we're going to put them right in your baby's mouth. Once those drops get bigger, or we collect several drops together, that drop gets bigger and bigger and bigger, then we can scoop that drop and collect milk by a spoon. And then when babies we swaddle them up so that we get the little arms out of the way. We'll tip the colostrum, which is very thick and sticky, just like honey. We're going to put the tip of the spoon right at baby's lip. We're not going to dump it in baby's mouth. Baby needs to be more upright, okay? We're going to tip it so that that honey-like milk can just get to the tip of the spoon, and baby's tongue will come out and lap up the milk, okay? This is a way of giving your milk that's very little effort for your baby, okay? Now, once we are able to express more milk by hand, we might collect it in a cup, a larger vessel, okay? That's where we'll use the same method. We're holding a little more upright. We're going to tip it just enough to get that volume to the tip of baby's lip, and baby's tongue will come out and lap up the milk. Okay, again, we're not going to dump it into baby's mouth. Both of these methods can be a little bit messy, but it's a really effective way of getting each drop into baby's mouth if they are not latching. Okay, you might see those being done right after delivery. They may use a spoon or a cup. So let's say we've got a lot here. Let's say we've hand expressed a lot of milk. We have another thing that we can use. We're going to pull up your milk into this curved tip syringe. So if we pull your milk up into here, or formula, or donated human milk, pasteurized donor human milk, pull it up in the syringe, baby will then suck on your finger, your clean finger with short fingernails that we had done before we had our baby. Baby will suck on your finger. The curved tip of the syringe will just go right alongside your finger. Not sure if you can see that there. And the tip of the syringe will go right into the pocket of baby's cheek. So while baby sucks on your finger, they will also be getting milk from the syringe. If they're able to pull it all by themselves, you can let them pull it as long as they're not going too quickly. Because anytime a baby eats too fast, whether it's with a syringe or a bottle, they typically eat more than they need because their brain and their tummy haven't had time to communicate that they're full. Okay, so we want to make sure that if baby's just sucking and it's pulling down very rapidly, we're going to take the syringe away, allow baby to suck on your clean finger until baby swallows everything they've got. Then you can put this back in to allow them to have a longer feeding, to give their brain and their tummy time to talk to each other. Like, hey, we're getting full down here. The brain gets the message and then the baby stops eating, right? So we want to make sure that all of our feeding methods that we use that are not at the breast, that we don't do them too fast, okay? So we have the spoon, we have the cup. The spoon and the cup we're usually going to use in the first 24 hours, and the cup only when we have larger volume. The finger with the syringe, again, once we have larger volume. But now if we have to supplement because the baby's jaundice, or maybe the baby is born early and just isn't able to put the work in at the breast, we have this supplemental nursing system, or SNS, that we can use at the breast. So if we have to give extra milk, whether it's yours, donated breast milk, or formula, when baby's latched to the breast, we sneak that little tail end of the long flexible feeding tube. We sneak the tail end of that into the pocket of baby's cheek while they're at the breast, and we can give them additional milk while they breastfeed. So the benefit of being able to give necessary extra milk, or anything that you want to give to your baby, anytime we do that at the breast, your body gets the benefit of the whole feeding. You get the stimulation, you feel all of it, and then your baby associates feeding with breastfeeding. So it helps you do more breastfeeding if breastfeeding is your goal. You can also use that long flexible feeding tube with your finger. So if you've already tried this at the breast, maybe your baby isn't able to use it, they're too tired, they're too fatigued, you can do the finger in the mouth again, and the little tubing is going to go right alongside your finger into the pocket of baby's cheek, and you can give milk this way too. Okay, so finger feeding with the syringe or the SNS is another option. Now, if your baby either is not able to use any of these alternative methods, maybe they're born too early, they don't have the energy for it, they're not coordinated enough, we can move to a bottle. I don't think I have a bottle with me. But the way that we pace a bottle feeding, so we slow them down with that bottle feeding process, it's going to help make it so they don't overeat, and that they don't expect the breast to flow the same way that a bottle does. Okay, so if we hold our babies more upright and not so much in a breastfeeding position, right, and we hold the bottle a little more flat rather than gravity assisting the feeding, then we can have babies a little more upright. They have to pull the milk out of the bottle instead of gravity helping. That helps slow down that feeding. And if baby is still suck, not taking any breaks, they're going to chug it down. You can tip the bottle back so baby gets air for a couple of sucks, not going to hurt your baby, burp your baby. Then you can put it back up once baby pauses, and then they start sucking again. So it helps you slow that feeding down so that they're used to having to work for the milk. They're not being overfed by gravity, and they're more likely to go back and forth between the breast and the bottle if necessary. Okay, now pumping, okay? First and foremost, everybody should get a pump at home. Some insurance companies won't issue one until your baby arrives, but find out from your insurance company how you can get your breast pump, because having a pump already at home before you need it is very useful. So contact your insurance company, find out their process. Some of them want a prescription from your OB. So it can take a little bit of time to get that whole process, and then they have to order it and ship it to you. So call your insurance company today and find out how you can get a pump at home. So there's lots of different reasons why we might get you pumping. Breastfeeding in and of itself does not require pumping unless there's an issue, okay? So if you're separated from your baby, if you have 5 kids and you're going for a procedure to tie the tubes, you might be off of the unit doing that. Or if your baby has to go to the NICU for any number of reasons, to be monitored more closely, you may be separated from your baby. So whenever we're separating you, we want to make sure your body is getting sufficient stimulation. Okay, so pumping, like I said before, is not going to get milk out of your body while you are making colostrum. We use it to stimulate your brain and push that hormone level high to keep that milk process going while you're away from your baby. Okay, so it's for stimulation only. If you feel pulling and tugging, it's doing its job. Now, having a pump at home, if we're pumping in the very beginning because of an issue, a potential impact to milk production, having that pump ready to go at home is really helpful. Okay, you do not need to bring your pump into the hospital. We use the Medela Symphony, which is in the picture here. Some of us have some experience with other brands, maybe our own personal use with the pumps or some research that we've done, but we're not guaranteed to know every pump that's out there. Your pump is most likely going to sit amongst your supplies of things, because our pump is going to be much higher quality, and it's going to be the better pump to use. Anything that you can get at home is not going to be as good as a hospital grade pump. Okay, even though they say hospital grade, that usually just means that multiple people can use the pump without there being any kind of bodily fluid cross contamination. So if yours says hospital grade, it still doesn't mean it's as strong as a hospital pump. So don't bring your pump to the hospital, but get one at home so you have it ready for you for when you need it. So some reasons we might get you pumping: if you have had issues with infertility, it's a hormonal process in the body. Sometimes when the body doesn't particularly want to be pregnant, sometimes we have problems with the lactation process as well. So if it's a hormonal issue in the birthing parent's body, we want to get you pumping as soon as possible after baby gets here to give your body additional stimulation and try to help that process along. So it's a risk factor, but not a hard and fast rule that you will have trouble with milk production. We just want to put everything out there to make sure that we give your body the best chance of a full milk supply if we see that there's a potential problem. If you have diabetes or gestational diabetes, it's really important to get pumping after delivery, because that hormonal process of diabetes can delay when your milk changes from colostrum to higher volume. Remember, tummies get bigger around day 3. And if we have colostrum for more days than what we anticipate, then there's a disconnect between where baby's tummy is and where we need that volume to be. So diabetes is a risk factor. Even gestational diabetes is a risk factor for having delayed onset of higher milk volume. You have milk, it just stays colostrum for longer than we want it to. So if we get you pumping in the beginning, we can try to get that transition to happen sooner than it might have on its own. So if you have diabetes or gestational diabetes, we will recommend pumping until that transition happens. If you have a small baby or an early baby, we're going to get you pumping, because small babies and early babies don't necessarily have the energy or the strength of suction to give your body really good stimulation. So the pump is going to help you do that. If we're supplementing with formula or donor milk for any number of reasons, whether it be medical or a personal decision, anytime we start giving milk that the body did not make, we're interfering with that process, and your body doesn't know that we fed the baby at that time. So the pumping gives your body the stimulation to continue with that milk making process and just knowing that we fed the baby. Okay. And then jaundice. Jaundice makes babies sleepier, so they don't feed as long or as well. And we may also be supplementing at that time. So pumping will be part of that journey just to make sure your body's getting enough of the message. And if it's your second, third, fifth baby and you have a history of having milk production issues, we're going to throw everything at it in the beginning with extra stimulation if we can, just to try to prevent that problem from happening again. Okay. If you do not have a pump at home, we do have hand pumps that you can take home that come with the Medela pump kit that we use here. It looks like this. So if you see this in Target, don't buy it. We have them here. Okay. This comes with the pump kit. So we'll have the hand pump that you can take home. We also rent our hospital grade pumps. So if you're like, my baby went to the NICU, I'm going to need to have a pump for longer. If you have WIC, they may loan you one of these hospital grade pumps. If you do not have WIC, you do not qualify for WIC, and you still want one of these pumps at home, whether your baby went to NICU or not, we do rent them. So that would just be something that you would ask about prior to your day of discharge. And then what to bring to the hospital. So bring a bra with you, a nursing bra, just in case your breasts start to get heavier as the milk volume comes up. Having something supportive is very helpful. No wire, nothing too tight. We also may use different treatments on your nipples, or you may bring treatments for your nipples, like the Amita Comfort Gels. There's a picture of them there. Silverettes. Those are two things that help to heal and soothe sore nipples, but they don't stay in place without a bra. So having a bra here can be helpful. The comfort gels from Amita is something that you would have to purchase and bring in. We do provide a different sort of hydrogel that lasts for a little bit shorter time frame than the Amita. The Amita comfort gels are much thicker and can last up to 6 days if you need it. So if you'd like to get that before, that's a great thing to pack and bring with you. The Silverettes. Silver is naturally antimicrobial, anti-inflammatory, which means it prevents the bacteria and germs from growing and causing an infection. And it helps soothe those sore nipples because it makes them less swollen. Okay, so if you can get those, they can be a little bit pricey, but if you get them from a baby shower or you choose to purchase them, bring them with you. Breast gels are something that you may or may not see. They're not as frequently used, but it has a little hole in it here so that your nipple can go through. If it's sore, it just prevents it from rubbing on your clothing. And you can bring whatever nipple cream you prefer. We do have lanolin nipple cream here that you are welcome to ask for. But if you have a preferred nipple cream or nipple butter, please bring that with you. Bring a nail file, a baby nail file, because babies are born with long fingernails. They are meant to scratch and stimulate at the breast, but parents get upset when babies scratch their own faces. So instead of putting mittens on, which limits your baby from experiencing the world through their fingertips, bring a nail file, soften those nails so that they don't scratch their face and they still can learn so much through their world with their very sensitive fingertips. So we want to keep those hands free, but we don't want them scratching themselves. So a nail file is a really great tool to bring with you. Haka, I know that's a brand that I mentioned earlier when I talked about the collection cups for milk collection if you're leaking milk from the other side. They also make kind of a vase type hand pump. If you have it and you want to bring it with you, we can show you how to use it. But they won't necessarily be useful in practice when you're breastfeeding in the hospital, because they are there to either catch what would have been lost or help to, both of them are going to catch. So you are not going to be necessarily likely leaking from the other breast until the milk volume transitions higher. So you can bring it, we can show you how to use it, but you probably will not be using it here in the hospital. So there's some reliable sources of breastfeeding. There's a few breastfeeding texts that you can look at here. I don't find anybody using textbooks anymore. Everybody's looking online, right? KellyMom.com is a really great resource. It's a great place to doctor Google something. So if you're going to go to the internet for information, don't go to TikTok or Instagram. go to Kelly Mom and then search what you're searching for. Everything there is research and evidence-based. There's LactMed, there's Mommy Meds. There's also Infant Risk. That's believe on another slide I have their information. But those 3 resources are going to be the most up to date on which medications are compatible with breastfeeding. Okay, so if you have a question, they put you on an antibiotic or they put you on a certain medication, you want to make sure it's safe for breastfeeding, you can look LactMed, Mommy Meds, or Infant Risk. They're going to give you the most up-to-date information rather than just asking your healthcare provider. Because more often than not, they're going to say, "Ooh, I just don't know. I'm going to have you pump and dump for the next 48 hours," when maybe it didn't need to be interrupted at all and that the breastfeeding could have continued on. So finding out for sure from either a lactation consultant or doing the research yourself is going to help you continue breastfeeding and giving your breast milk if it's safe. Okay, so I told you that I was going to tell you about our lactation clinic, and here it is. Okay, so we have the lactation outpatient clinic where we see patients one-on-one in person. This is after you've been discharged and if you need additional support. The phone number for the clinic is here, and the phone number for us, our lactation warm line, is here in 2 places. So if you have a question when you've gone home, give us a call on the warm line and we can answer your question. Usually we'll call you back within about 24 hours. If we're not in the office, we spend a lot of time in patients' rooms. So if we are not in the office to answer your phone call, please leave us a message. We will call you back when we are first able to. If you have a PPO insurance, so find out what kind of insurance you have if you don't already know. With PPO insurance, you can just call and schedule in the hospital if you already know that you're going to want lactation follow-up. You can schedule right away. If you have an HMO insurance, you're going to want to call your OB to get a referral for the outpatient lactation clinic. Most of the time they cannot give a referral until after the baby is born. So if you have an HMO, just wait, be patient. And then if you want to get scheduled in the clinic, that's when you would call them after the fact or send them a message. And then the referral needs to be faxed to us, and the fax number is there on your screen. On Tuesdays, we have a free virtual support group. It's every Tuesday on Zoom. That postpartum support group or education book that you're going to receive in the hospital is going to have a QR code for you to scan. Okay, it's here. I would hold this up and have you scan it here, but I think this one is the old QR code. So your book should come with an updated information on how to get into that virtual support group. But it's really, really fantastic. It's a great way to connect with other parents that have newborns. It's not specifically for new parents. It's just when you have a newborn in the home and you need additional support. Okay. The postpartum period can be very isolating and it can be challenging, and just having a place to talk and share and communicate with other people that are also going through kind of a similar stage is really, really helpful. So finding your network and building your support group before you have your baby can be really helpful. And just know that that support group is there for everybody. You don't have to deliver at our hospital. Towards the end of the group, our lactation team does hop on to the Zoom call to offer any breastfeeding question or breastfeeding support. So it's another great support for you there. In building your community, here's some other places that you can look. There's WIC, the Laulhere League. There's Facebook groups that you can look into. Finding what community you resonate with the most, and surrounding yourself with people that are supportive of breastfeeding. Here at the hospital, we offer the Welcome Baby program. If you are enrolled, and they provide, it's really a fantastic service. They come to your house, they check on you, they check on baby, they can give you some lactation support and let you know if they think you need to be seen in the clinic. Usually they'll reach out to you. If they haven't, you're welcome to call. The number is there on your screen. And they also will reach out in the hospital if they haven't already connected with you to try to get you signed up. But it's a really great program that helps just give you continued support after you've left the hospital. Now, I know right now we are not thinking about going back to work. Hopefully that's not what's on your brain. And right after your baby's born, that's not what you want to be thinking about either. But going back to work and pumping and trying to figure out when to express and all of that, it's something to kind of plan ahead for. So talking to your workplace, knowing your rights, knowing that they need to provide break time for employees to express milk. They need to provide you a safe space to express your milk that is not a bathroom. Okay. That link there is going to take you to a website with more information on the workplace accommodations. So just knowing what your rights are and having that conversation before you go out on leave is helpful. So managing, going back to work, pumping and bottle feeding can be introduced around week 4 if breastfeeding is going well. So again, we're going to have that growth spurt, that second growth spurt right around 2 weeks. Once that calms down, it's like, okay, I think we're good. Baby's not as fussy as they were. They're not feeding as frequently again. That's when you can introduce a pacifier. Pacifiers are recommended by the American Academy of Pediatrics after breastfeeding has been established. So getting that breastfeeding going really well first, around 3 to 4 weeks, we've come out of that growth spurt. Breastfeeding is going well. You can introduce that first bottle too. We want baby to be able to take a bottle, especially if you're going to be away for any reason, going back to work, going back to school, needing a day out of the house. It's okay to take space. Go get your nails done finally, right? So introducing a bottle around 1 month, 3 to 4 weeks, is going to be a good time for baby to still learn a new skill where they're not as likely to be like, yeah, no, I don't want to do anything different. I just breastfeed, right? We want them to also learn bottle feeding once breastfeeding is really well established. So around week 4. Stimulation is key. So if you're away from your baby, we want to make sure we're pumping at any missed feeding so that your body still gets the message. Hey, we're still making milk for this baby. This baby is still eating it. So we want to make sure that we're continuing that stimulation. There's no bottle that can mimic the breast exactly. So having a variety of bottles at home can be helpful. And just planning ahead, right? Getting the pump from your insurance. They should provide you one for free. You may be offered the opportunity to pay a little bit extra to get a pump of your choice, but they should offer you a free pump. Having some bottles ready to go to try, and just knowing what your rights are in the workplace and talking to your employee or employer before that time comes can be helpful. Okay, as far as nutrition and exercise, there are no dietary restrictions when breastfeeding, although following the FDA guidelines for consuming fish, just like a healthy diet. You can go back and eat your soft cheeses and your deli meats and go get some sushi. You can breastfeed with spicy food. It's okay. Breastfeeding women actually burn up to 1,000 calories a day. So you may end up burning more calories than even when you were pregnant. Drink to thirst and then some. Thirst is the first sign of dehydration. So we don't want to get thirsty. We want to keep ourselves hydrated. Follow your OB's guidelines for exercise. Normally between 6 to 8 weeks postpartum is a good time to start some just low exercise, right? We don't want to do anything crazy. We want to lose weight gradually because drastic weight loss can actually affect your milk supply. And then give yourself grace. It is okay if you cannot exclusively breastfeed. Some milk is better than no milk. Breast milk in a bottle is just as good. And breastfeeding is not what makes you a great parent. Okay, I think we put a lot of weight on breastfeeding and exclusive breastfeeding, and we are so hard on ourselves. We need to make our mental health a top priority. And if breastfeeding is a hard thing, that's okay, that's normal. If it's not exclusive, that's okay. Just keeping yourself mentally healthy during the process, knowing where to pull back and when to ask for support. And we're here to support you and your feeding choice so that you can enjoy your baby, enjoy the process, and be successful in whatever way breastfeeding looks for you. Breastfeeding is not black and white. Some moms choose to exclusively pump and that works for them. Some decide to combo feed, and it's just letting us know what your goal is so that we can help you reach your goal and you making educated decisions, right? But talk to yourself like you would talk to a friend. I think we are all the hardest on ourselves and we have a really negative inner monologue. So surround yourself with supportive people and try to be a support for yourself. Okay, so give yourself grace, take a deep breath, and ask for help. And the last thing I'll leave you with here is a QR code for the Yomingo maternity app. It offers tools and support for every stage of pregnancy. It allows you to read, watch, and learn from media content library. You can track your kit. It has a kit counter while you're pregnant, and it has a baby tracker after you delivery, so you don't necessarily need to use the book. There are a lot of baby tracker apps out there, but I love that this app has everything from being pregnant to after delivery and beyond. It helps you manage your pregnancy and track milestones. You can register for pregnancy classes, and it's actually offered in 14 languages. So highly recommend the Yomingo maternity app. You can scan that code there. So I will end by just saying thank you for your time. I know this was not a short class. It's just chock full with a lot of information. You can rewind, watch it again as you're getting closer to your due date, and just remember to ask for help. All of our nurses are trained in breastfeeding support. And if things are even more challenging, don't be shy to ask to get the lactation team involved. And I really hope that I see some of you here. Let me know if I taught your class, and if I'm there in the hospital. I always like to know that you've seen me before. Thank you again, and the best of luck to you in breastfeeding. Take care.